Thanks for joining us. Today we're going to discuss health information technology in the developing worlds, particularly in the country of Saudi Arabia, and exploring others like US and Great Britain. So the thought of owning information invokes a thought of property and ownership for profit. And so with health information, one of the things to think about is why is it regulated and what is it exactly? To understand what it is, and why it's regulated, we're going to discuss that here. Now, health information technology and information in general is regulated to protect each subject by meaning a patient, and all the information that is disclosed upon a person's health information setting, whether you're in a doctor, hospital, all of that is kept safe, and that is heavily regulated because of the sensitivity of the nature. Now, what is health IT? Health IT in content is all of a medical record that has information that is collected and stored by database systems. These database systems are heavily regulated as well, are extremely expensive and heavily funded by governments, incentives provided by the government, and also by fundraising and developmental incentives. Now, there are a few strategies that can be taken to implement and to drive this new research and technology forward in other developing worlds, such as the Kingdom of Saudi Arabia, where they find themselves not being able to meet the supply and demand, where the population is growing steadily and heavily, and primary care practitioners in particular are not being able to meet the demands of the nation entirely. So what happens is a great force like health IT comes in and tries to collect the data to see where there are pitfalls, where the donut holes, if you will, lie, and where that can be fixed. The problem with that is that right now the incentives, the development, and the resources are not available in countries like Saudi Arabia, Mozambique, and others, just a few to mention. Now, the three developmental steps for implementation, if you'll see here, is development to understand how to apply the technology to solve and substantially change how healthcare is being delivered by measures of technology. Then demonstration, credibly measure and communicate sustainability and business benefits. Why does it benefit a practitioner? Why do operative level medical examiners need things like this, like medical assistants, nurses, physician assistants? How does it benefit that? Because the cost is so great that many of these developing countries cannot simply afford it or sustain the technology, the systems that it requires, or have the education to do so. And so then one of the last implementations is adoption. Manage change and successfully implement new approaches. How can a third world country like in the Kingdom of Saudi Arabia come to terms with the new times, with technology, with new advancements in machinery, things as such? Now, in order to also kind of explore this idea and this concept, there are also 6 steps to success in order to make this fully functional. In these 6 steps to success, you'll find that data collection, very important to see how effective are we in collecting this data and keeping this data, and also being able to provide the community, the system, the establishment, the opportunity to see where things are thriving and where things need help. In many cases, even in the US, we find that this implementation starts here, the data is being collected, and we find that either accessibility, as for the Affordable Care Act, is either there or not there. In many cases, in socioeconomically deprived areas where the information is not being collected and it's just not afforded, it's not available. And so then the second step would be research and incentives. Continually finding out other measures, other ways to become more efficient, more effective in delivering the service. And health information technology being such a big bear to just come in and try to implement requires a lot of time, a lot of knowledge, and a lot of professionals to back this information up in order for there to be an incentive to actually have somebody there to back you up financially. And a lot of these private hospitals, public hospitals really need the research in order to be able to provide the data that this does work, that this is going to be environmentally friendly, that this is going to increase profit, that it's going to eliminate waste, and the data collection is in fact safe and effective. The third principle there is patient privacy. How is medical data collection going to ensure that the patient's privacy and confidentiality will continue to be of utmost importance as per HIPAA and the Portability Acts that are to follow. Now, standardization in the US is there. There are many standards there. But in third world countries, and like Saudi Arabia, that's the biggest part right there is number 3, patient privacy, and then of course going into number 4, portability. How do we get all of this to merge? One of the pitfalls for the third world country is that patient privacy is not standardized, so there's not a national or federal implementation of standard there where they have to abide by. It's kind of all, one for all for one, and privacy is not an issue, which it should be. And confidentiality as well. The portability, how are we going to make systems interoperable where we can establish a system where all networks are communicating and all systems are going to be relative in ease and access for all practitioners and those in the medical field. Number 5 is the health information technology implementation, which goes back to the third step in the previous slide here. You'll see that in order to implement, it will take an additional 3 steps for step number 5 here. And of course, that again is to reiterate, development, demonstration, and adoption. Now, taking all of steps 1 through 4, putting it together as they are implemented, and then really hitting hard with number 5. Number 5 is super important, but only can be successful and thrive once 1 through 4 has been accomplished. And then lastly, the data exchange among providers. Being able to establish a network where if you are in France and you're from France and you're hurt in Saudi Arabia, the networks will all be cohesive, and one provider can communicate effectively and efficiently with another provider without compromising confidentiality, any of those breaches, and still being able to deliver exemplary service, healthcare service, and the delivery system is not compromised. So what we're looking at is being able to service any person, any patient from anywhere, and have a national networking service through the medical health information technology realm. And then after that, of course, we find ourselves mostly finding the issue where research and incentives are our biggest feature. Now, we're talking about money. Money is the biggest trailblazer behind all of these incentives and all of these researches and being able to implement such a huge, large, and evolving beast, if you will. So the future of healthcare includes significant technology-based solutions, starting with health information technology and extending beyond, as offered in many settings such as private and public practice, virtual medical doctors, and also patient transportation, portability, environment, and other educational and career benefits that come with this. But the implementation of such a large and evolving healthcare industry in the technology world really is dependent on the 6 steps up to success to be able to provide this in the developing worlds. And so hopefully we can get this on board, and the World Health Organization, Human Health Services can collaborate and collectively find data collection analysis to work in all countries where this can be streamlined, supported, and then expanded would be beneficial to everyone. So thank you for joining us. This is our take on health information technology in developing worlds. Now, any questions?
Yes, my question is that this needs to be a global initiative. This has to be something that's globally accepted, so it works for everybody.
It doesn't have to be global. It's not global, actually. And so what we find is that a lot of the third world countries are rampant with disease, illnesses that can be prevented. One of the problems is, for example, in the nation of Saudi Arabia, where patients are being treated for the same illness, the same disease over and over again because they travel. Some are traveling tribes, and so they move from one location to another. So what happens is they're seen by their town physician or their town pharmacist or whomever it might be, and then they move on to the next. And what happens, there's no communication, there's no medical record, there's no what we call EMR, an electronic medical record, and there's nothing that is digital for one doctor to see in this area, oh hey, this person was seen at this date at this time and was prescribed this or was treated this way. So this person is now coming in, let's say with malaria, or with intestinal parasites, things like that, where they are being treated with the same medicine. So they're resistant, and then it perpetuates disease, perpetuates illness that could eventually be non-existent to them or in their family, but it just keeps growing. So it's one of those things where if we were able to take a nation, and the nation do this, it's not that the US has to do this, but the very nation itself become more effective, more efficient, and developed in research for this technology, it would increase a level of careers. It will increase technology itself. It would implement other fast havens for the population, because the population is growing so much, and private practice, and primary care physicians are becoming so less dominant in this field, because in Saudi Arabia they have 3 tiers of healthcare, and each tier of healthcare is specialized. So if you fit in tier 1, you have a cold. In tier 2, you have something a little bit more, maybe internal disease, and then step 3 would be something terminal. And so the way they establish their healthcare delivery system is based on the 3 tiers. And if those 3 tiers were able to communicate, a person with the first onset illness of, let's say, cancer, would eventually become more and more ill over time, but we could probably delay that in some part of the tier if medical technology like health information technology was implemented to better provide a service to them, better treat, have better clinical studies for them, and the data collection would then grow, and we would know, okay, this is where they are affected. This is where Saudi Arabia is lacking, maybe in infectious disease, and we need to upscale, how many infectious disease doctors we need for this area. So the implementation of this technology is not a global thing, it's a national thing, and each country will support itself. But in order to do that, each country has to find a benefit for doing so. The providers have to find a benefit as well, and also the incentives. And so bigger nations like Great Britain, the United States, because we are trailblazers in this field, we would be the ones to help implement it, but they would have to sustain it. Any other questions? No? All right. Well, thank you very much for joining us. That's it for questions, and I hope that you have learned something, enjoyed this talk, and I will see you soon. Thank you.